Children's Mental Health Week highlights need for innovative service provision. Children's Mental Health Week 2024 is a timely reminder of the critical importance of prioritizing the emotional well-being of our youth. In a world where children face an array of challenges, from academic pressures to social dynamics and familial stresses, fostering resilience and promoting mental wellness are paramount. Against the backdrop of escalating concerns and growing demand for mental health services among children, it becomes even more important to empower people to explore different tools and supports to empower our children. Hypnotherapy emerges as a beacon of hope, a powerful yet gentle tool that holds tremendous promise in nurturing children's mental health and giving them tools to thrive. The theme of Children's Mental Health Week 2024, Speaking Up About How You Feel, works to further erode the stigma around mental health that still exists in the UK. Encouraging children to articulate their emotions, seek support, and cultivate resilience are essential components in fostering a culture of empathy, understanding, and acceptance. Recent data underscores the magnitude of the mental health crisis gripping our youth, with a surge in emergency referrals to child and adolescent mental health services across the UK. The statistics paint a stark picture: an alarming number of children grappling with anxiety, depression, eating disorders, and other psychological issues, often exacerbated by prolonged waiting lists and limited access to timely interventions. The repercussions of untreated mental health conditions can be profound, affecting every aspect of a child's life and hindering their potential for growth and fulfillment. To further explore the importance of mental health awareness and support for children, let's delve into the various stresses and challenges that contribute to the growing prevalence of mental health issues among young people today. Academic pressure and performance anxiety. In today's hyper-competitive academic environment, children are under immense pressure to excel academically. From standardized tests to rigorous coursework, the demands placed on students can be overwhelming, leading to heightened levels of stress, anxiety, and perfectionism. The fear of failure and the relentless pursuit of academic success can take a toll on children's mental well-being, impacting their self-esteem and sense of self-worth. Social media and peer pressure. The pervasive influence of social media has transformed the way children interact, communicate, and perceive themselves and others. While social media platforms offer unprecedented opportunities for connection and self-expression, they also expose children to a barrage of unrealistic standards, comparison, and cyberbullying. The pressure to conform to idealized images and lifestyles portrayed on social media can fuel feelings of inadequacy, insecurity, and isolation, exacerbating mental health issues such as depression and anxiety. Family dynamics and home environment. The family environment plays a pivotal role in shaping children's emotional well-being and resilience. High levels of conflict, instability, or dysfunction within the family can create a breeding ground for stress, anxiety, and emotional upheaval. Children who experience neglect, abuse, or adverse childhood experiences may carry the psychological scars into adolescence and adulthood, predisposing them to a myriad of mental health challenges. Trauma and adversity. Childhood trauma, whether stemming from abuse, neglect, loss, or violence, can have profound and lasting effects on a child's mental health and development. Traumatic experiences can disrupt the brain's stress response system, leading to symptoms of post-traumatic stress disorder, PTSD, anxiety, and depression. Without adequate support and intervention, children may struggle to process and cope with the emotional aftermath of trauma, perpetuating a cycle of psychological distress and dysfunction. Socioeconomic disparities and access to care. Socioeconomic factors such as poverty, inequality, and lack of access to healthcare can exacerbate mental health disparities among children. Families living in poverty may face significant barriers to accessing quality mental health services, including long wait times, limited availability of providers, and inadequate insurance coverage. As a result, children from marginalized communities are disproportionately affected by untreated mental health issues, perpetuating cycles of disadvantage and inequality. In the face of these challenges, hypnotherapy emerges as a promising avenue for addressing the complex interplay of emotions and experiences that shape children's mental well-being. Unlike conventional therapies that may carry risks or side effects, hypnotherapy harnesses the innate power of the mind to facilitate profound healing and transformation. By tapping into the child's imagination and subconscious, hypnotherapy enables them to explore their inner landscape, confront their fears, and cultivate inner strength and resilience. The essence of hypnotherapy lies in its ability to bypass conscious barriers and facilitate deep introspection and healing. Through guided imagery, relaxation techniques, and suggestion, hypnotherapy empowers children to explore their thoughts and emotions in a safe and supportive environment, free from judgment or constraint. It offers a holistic approach to mental wellness, addressing not only the symptoms but also the underlying causes of emotional distress and imbalance. Children's Mental Health Week 2024 serves as a rallying cry for greater awareness, understanding, and action in addressing the mental health needs of our youth. Hypnotherapy, with its ability to facilitate profound shifts in perception and behavior, aligns seamlessly with the theme of speaking up about one's emotions and seeking support when needed. It empowers children to embrace their emotions, express themselves authentically, and cultivate a sense of agency and self-compassion. As we navigate the complexities of children's mental health, it becomes imperative to prioritize prevention and early intervention. Hypnotherapy offers a proactive approach to mental wellness, equipping children with coping skills, emotional regulation techniques, and self-awareness tools that empower them to thrive in the face of adversity. By addressing underlying psychological issues and nurturing emotional resilience, hypnotherapy lays the foundation for long-term well-being and fulfillment. Moreover, the accessibility and versatility of hypnotherapy make it a valuable resource for children from diverse backgrounds and circumstances. Whether used in schools, clinics, or community settings, hypnotherapy provides a safe and supportive environment for children to explore their thoughts and emotions, heal from past traumas, and build a positive sense of self-esteem and self-worth. If you, or someone you know, would like to seek hypnotherapy from a trained and insured professional, you can find their details via our therapist finder.